Spinal discs and degenerative disc disease. Between most of the bones of the spine, the vertebra, there is a disc. Now these discs are squishy, water-filled substances that help deal with compression forces going through the spine. Now as we age, so do the discs. They become drier and damaged. Now things can speed up this process. So small, constant injuries, such as from poor posture, or larger events such as lifting heavy objects, all speed up the degenerative process of the discs. Now, although there are new treatments coming out all the time to help target the disc itself and heal it, the best treatment still is preventing the disc from degenerating in the first place through good posture and good lifting mechanics. Now let's get into some of the anatomy of the disc. The disc is made up of two parts, a middle part and an outer part. Now the middle part, seen here in blue, is called the nucleus pulposus. Nucleus meaning middle, pulposus coming from the word pulp, meaning jelly-like. So it is the jelly-like substance in the middle of the disc. And it has a very important role, because it is this substance that allows the disc to be squashed and then expanded, meaning it can reduce the amount of force going through the spine. Now this jelly-like substance is encapsulated by a fibrous capsule, the annulus fibrosus, seen here in black. Now annulus means round and fibrosus meaning fibrous. So it is the fibrous capsule around the disc. And it also has an important role, because its role is keeping the jelly-like middle exactly where it is, because we do not want this disc material in the middle escaping out. If it does, we commonly term this a disc herniation. Now another important thing to know is where the disc is. It's located in between the bones of the spine, the vertebra, one above and one below. Now an important thing to know about the vertebra, seen here in green, is it has a lot of blood. It is highly vascularized. So we'll draw some blood vessels here in red coming into the vertebra. So the vertebra has a lot of blood. On the other hand, the disc does not. It is actually very poorly vascularized. So it needs to get its nutrients from the blood from elsewhere. One of those places being the vertebra. Now another important piece of information to know is a very specific piece of the vertebra called the end plate. Now the end plate I've drawn here at the top of the vertebra. Now as the name suggests, it is a plate at the end of the vertebra and is kind of like a growth plate that you find in other bones in the body. Now it has lots of holes in it, so it is very porous. So we'll draw some holes here. Now what these holes in the end plate of the vertebra allow is blood to come from the highly vascularized vertebra through into the disc. And so the disc now has nutrients. Now the disc also has nutrients that comes from outside. So just on the edges of the disc, there are also blood vessels that bring a little bit of nutrients. So those are the two ways that nutrients can get to the disc. Now, an important thing to know about degenerative disc disease is about this blood supply. Now, as we go about our lives, our vertebrae take a pounding. Much like the knuckles of a boxer, they become hardened over time. They become sclerotic. Now what this means is actually these holes in the vertebra become hardened. They almost become filled up. So the end plate of the vertebra no longer is porous, which means it no longer can bring blood from the vertebra into the disc, meaning that the disc gets less nutrients and begins to degenerate. Now also, as you might know, our vascular system ages as well, meaning that small blood vessels are no longer able to bring as much blood as they once did. So the blood vessels on the outside of the disc also begin to not work as well. Again, meaning less nutrients into the disc, meaning it starts to degenerate more and more. Another thing to know about the disc is its water content. The disc is full of water. Now the way it holds onto its water is through a small molecule called aggregates. Now aggregates are a GAG chain that aggregates water. So GAG is just the amino acid sequence that makes up the chain, and it holds onto water. It aggregates water, hence aggregates. So these aggregates are everywhere within the disc. The disc is full of them, meaning the disc is full of water. And this is good because we want our discs to have enough water so that they can keep their height, so that we can keep the loads of the spine reduced. Now, as we age, our disc goes through damage after damage, and that causes minor inflammation again and again. And what that does is it makes the balance between cells being made and cells dying shift towards more cells dying than are being made, which means that as we age, our discs get less and less aggregates and therefore less and less water. Now what this means is our discs dehydrate, making them shorter and smaller, and also making them drier and therefore more likely to tear. Now on the other hand, in the morning, our discs are actually at their most hydrated. The reason is because your spine is lying flat during the night whilst we sleep, the pressures are less, and so the water is not squeezed out of them. However, as we get up in the morning and we straighten up and put forces down our spine, that compressive force squeezes the disc like a sponge and the water escapes out. Now this might sound bad, however, if our discs are hyperhydrated, like they are in the first hour in the morning, they are actually also likely to tear because they are softer. So that's why you shouldn't exercise within the first hour of waking, because your disc is actually very soft and pliable and so can tear easier. So you should wait a little bit for the water content to decrease before exercising. The discs aren't something we normally feel pain in. Unlike stuff like the skin or muscles where damage will give us pain, the discs are not something we normally feel a sensation in. Now the reason for that is because the discs, much like its blood supply, doesn't have a lot of nerve supply. However, as our discs degenerate and the amount of water within the disc decreases, the pressure in the disc also decreases. Now what this means is that things that want to grow within the disc now can, because previously the water pressure was pushing out into the disc and so stopping things growing in because of the pressure. But as the pressure decreases, blood vessels and nerves can begin to grow into the disc. So we'll draw nerves and vascular, the neurovascular bundle, in green, growing into the disc. Now, because the nerves and the blood vessels are in the disc, we can now begin to feel pain in that area. Now, because it's not a very old system, these nerves will not be very specific. Unlike the skin, where you can tell exactly where the pain is, the discs are a little bit more diffuse and dull, which is why disc pain is often that dull, deep pain you feel. Although you can tell where the area is, you can't point exactly where the pain is, which is why the symptoms of degenerative disc disease often are this diffuse lower back pain, if it is the discs in the lower back which are degenerated. Finally, treatment of degenerative disc disease. Now, as I said before, the best treatment is actually preventing it in the first place, through good posture and good lifting techniques. However, if the disc has already begun to degenerate, the best thing to do is first to target the muscles around the disc. Make sure that they are not adding to any sensation of pain through trigger points or overworking. So target the muscles around the area as well. Secondly, it's stopping the disc from degenerating further and reducing whatever inflammatory process may be going on there at the time. Again, this is good posture and good lifting mechanics will help that. Once you see the pain begin to reduce, you can start to really improve on strength and functionality. This includes strengthening big muscles like trunk muscles and glute muscles that help with posture and lifting technique, as well as your overall mechanics, lifting stuff up, reaching to the ceiling. Now, in certain situations, such as a disc that doesn't seem to be healing with the normal treatment, or a disc that is believed to be too far gone for normal treatment, surgery can be an option. However, that is normally a very late stage. Thank you.